So I trained an undergraduate at Cal Poly San Luis Obispo, where I played Division I athletics. I was a football player back there, which led me into orthopedic surgery. For my orthopedic surgery residency, I was at UCLA and then went off to Hospital for Special Surgery in New York for my hip and knee replacement subspecialty fellowship. So my focus is on hip and knee replacement surgery, so common conditions in which would bring you to me would be things such as most commonly osteoarthritis or wear and tear of our joints, where you run out of cartilage, the bone may be rubbing up against bone, and it's causing pain with most activities that you're doing. That's one and probably the most common condition that brings you to a total joint replacement specialist, such as myself. But there are others, so patients with autoimmune conditions such as rheumatoid arthritis, post-traumatic conditions, congenital conditions, some conditions people are born with, or genetic causes that lead to end-stage arthritis. All these conditions lead to a mechanical issue, in which case a hip or knee replacement may be the only solution. So those are common conditions that typically bring you into my office. So I try as best I can to get to know my patients, because I think a lot of aspects about individuals that come into my clinic are important to the outcome and success of the procedure that we're going to eventually do and then see you through at the end. And so my philosophy in how I do hip and knee replacement surgery is really guided around the entire patient. For example, if patients who come into my clinic with osteoarthritis of the hip or knee, if your goals are just to go back, be a community member, walk the downtown San Clemente every so often, that's great for you and we'll get you back doing that goal. However, a patient coming to me who's looking to go skiing 10, 20, 30 times a year, very different goals. And so it's important to me to get to know my patients, execute a surgery that's the best for them, and then see them through to the end till they're back doing the things they enjoy doing. A trend you may have heard about, and you will see more and more, is the integration of technology in hip and knee replacement surgery. So for example, I do robotic-assisted hip and knee replacement surgery, and I think a lot of people don't know exactly what that is. All these technologies, it's not a robot doing the procedure. It's a tool that I use to execute an accurate and precise surgery, and it's becoming such that I can then personalize the approach to each individualized patient. In addition to robotics, there's technologies that are being used in the pre- and post-operative setting as well. For example, a lot of my patients get enrolled into a virtual care assistant that can give you, in a virtual manner, exercises to do, education material, and ways to get in contact with my staff. Post-operatively, what these virtual care assistants can then do is then monitor your progress. If you enroll into the specific portion of the application, it can monitor your objective data, and we're building AI algorithms on top of that to help monitor you even further, to help now provide some predictions in how you're doing and how you're going to do. So my favorite part of doing what I do, being an orthopedic surgeon, is that I help people on a day in and day out basis. So being able to see my patients achieve their goals, get back to living their lifestyles, is a very rewarding aspect for me. And it's something that I really enjoy, meeting a lot of the patients that I take care of and getting to know a lot of these people. So I've been blessed in that I get to do what I love to do, and I look forward to a long career doing that.